Thank you very much indeed. Well, I'm here to speak to you about the health service, and frankly, I'm not sure I know where to begin. But I think I'll begin by welcoming Tony O'Gorman here to the Labour Party conference. Tony fought like a lion so that his sick wife, Breatha, could have the treatment that she desperately needed. So I want to pay tribute to those two and to all those other people who suffer needlessly and often in pain as they wait for the health care they need and the health care they deserve. The hundreds on trolleys in our A&E departments, the thousands of patients, some of them with cancer, some of them with heart conditions, who are waiting for an appointment with a specialist or an operation, and the thousands more who had their appointment cancelled to make way for A&E patients because Trolley Watch and the bad publicity surrounding it has upset Minister Harney. Nothing can disguise the extent of government failure. While patients wait, those who care for them are enduring the strain. Nurses have now embarked on a course of industrial action because their grievances are being ignored. Impact members have declared a vote of no confidence in the Health Service Executive, of which they are a part. And it will take a new government to bring in the vital reforms to the hospital consultants' contract. The shambles presided over by Minister Harney has actually been immeasurably worse by her mania for privatisation. Private good, public bad. That's the PD ideology. Well, it's not ours. I promise you, the Labour Party will end the PD plan to build private hospitals on public lands. And I promise you too, we'll bring some common sense back into health policy. This government has failed. While Labour is successfully laying the foundations for a good and a fair health service that meets the need of the old, the young and the sick, we intend with Fine Gael to provide access for patients to their family doctor by providing free GP care to every child under 5 and medical cards for up to 40% of our population. We will build 2,300 acute hospital beds and 1,500 community nursing beds to alleviate the terrible pressures on the hospital sector. It's a no-brainer. We have to have the beds to meet the crisis and to tackle the scourge of MRSA. And we'll embark on a new and a radical initiative towards a fair system of funding by providing health insurance cover to all young people under the age of 16. We'll increase the percentage of the health budget for mental health and help for those at risk of suicide. We'll ensure patient safety, and we'll engage in a spirit of partnership with all the key workers who are part of the health service and who have so much to contribute to making it fair and efficient. And we've one chapter left to publish in our agreed health plan. Tackling inequality is a core value for the Labour Party, and it's a vital task, particularly in relation to health. A fair society is a healthier society. This we know. Sharing our social and economic advances equally means that good health, even life itself, can be shared more equally. In the coming months, Fianna Fáil and the PDs will offer the voters in regards to health more of the same. We will present them with a clear choice. Our vision of a health service that we can all be proud of, well-resourced, well-managed and dedicated not to making profit but to making patients well and to caring for all of us from the beginning to the end of our lives with dignity and respect. Thank you.
Deputy Party Leader Liz McManus there with Labour's plans for major expansion of the health service. That ends the health debate. Now, delegates.